My position is to listen, and my job is to interview patients to get their perspective on their care that they have had at Dartmouth-Hitchcock. And this is so important because the perspective is what the patient takes into the community and the feeling with which he or she leaves the hospital. We check with the staff and the nurses first to see who is available for an interview or a visit, or who might have had a problem that the staff would like to clarify. I am received very well by most patients. A few are really reticent and don't feel like talking. But I cannot tell you how many patients, as I'm leaving the room, say, "Thank you for doing this. This is very important to have the medical center care about the patients." When the family members are there, I talk with the family members too and make sure that they feel a part of the whole experience. My role in this work is to be the link between the patient and family and the staff, to help the families and patients know that the staff is basically on their side, trying to help them, and needs to know their concerns. And if they have concerns, to feel free to discuss them, and the care will be better in that case. If I hear a complaint or problem that I think needs attention, I will first speak to the nurse who has that patient in his or her care. And then perhaps that can be all settled right there. Could be an misunderstanding or something that the nurse can do. And if that is not solvable there, I go to the unit manager, and she often follows up. If it's really an issue, with their permission, I talk to the nurse and I talk to the unit manager, nurse manager. The complaint will go to the Office of Patient Relations, where there are two specialists who follow up on these things. And we don't take our cases to them lightly, and we always inform the staff that we are going to them if we do. I do this work because I want to make Dartmouth-Hitchcock better than it is. I do see this as something that is very valuable, and in this culture of caring, that we are really caring what our patients say, caring about what they say. The interrelationship between the volunteers and the staff has become one of respect and friendship. It takes a while when you first start to build up the confidence of the staff, because they think perhaps, oh, she's a spy and she's going to just find all these things that are wrong. But now I have just a great relationship with the staff, and the other patient voices volunteers do too. And we have built this up, and it's mutual trust. They know that we are doing this to make things better. They're there to make things better. And it's been a very, very good relationship. I have had nurses say to me, after you've seen that patient, if you have any insight into what I could do better, let me know. I think that's a very positive outcome. We can't fix it if we don't know about it. And if we know about it, we can make an attempt to make other people's stay better.